Be careful when working into the corneal endothelium. We see that nuclear fragment of that viscoelastic. We can remove them, but you must be very careful. This first case, finished removing the cortex from the eye, and you can see there are little bits of nuclear fragments up against the corneal endothelium. And right there centrally, just to the right of the Purkinje image, we see those opacities, and they're stuck in the viscoelastic against the corneal endothelium. So instead of trying to remove them directly, let's first inject our cohesive viscoelastic, and maybe we can displace it a little bit. That'll help loosen it up and shift around the dispersive viscoelastic, which is sticking it to the corneal endothelium. Now we'll put the IOL in the capsular bag, and at the end, when we have our viscoelastic removal setting, then we'll be able to remove that material and get it away from the corneal endothelium. Remember, for our viscoelastic removal setting, we're using, of course, a high vacuum, but also a high flow, so we have enough fluid flowing through the eye to really wash that out. But we also had the help of this cohesive viscoelastic to help displace those little bit of nuclear or cortical fragments that are near the endothelium. So now we'll position the lens where we want it in the capsular bag, and here we go with the IA probe. First, let's do the routine things, removing viscoelastic from behind the IOL, cleaning out all the viscoelastic from the front of the eye, and then we'll come very close to the corneal endothelium. And the IA probe is very well suited for this because the aspiration port is facing right up towards endothelium. Don't touch the corneal endothelium. If you need to leave those little fragments, leave them, but never touch those central cells. Here's a case where we're doing some phaco chop, breaking up the nucleus and taking out the epinuclear shell here. And just on top of the phaco probe, there's a small nuclear chip, and it's stuck up against the corneal endothelium. Don't try to remove it with the phaco probe. That's too big of an instrument. It's not precise enough. So we're leaving that little nuclear chip there, and we'll try to get it with the IA probe. And we can adjust the tip here, go port up, there. Now we can grab it, bring it away from the cornea, bring it down to the iris plane, and then push it in the aspiration port, and we can finish the case here. So any little bits of nuclear fragments or viscoelastic or anything else that's stuck near the corneal endothelium, don't try to remove with the phaco probe. You want to use the IA probe, and you want to do it even later in the case. A lot of times, injecting the cohesive viscoelastic that you're going to use to implant the IOL, that can help displace it. And remember, when in doubt, it's okay to leave a tiny little bit up against the endothelium. It'll wash away slowly in the normal currents of the anterior chamber within a few days. But you don't want to damage those cells. Let's look at one more case. In the end of the case here, removing the viscoelastic from behind the IOL. And you can see with this great red reflex and this very pale eye, you can see as we remove the viscoelastic from near the endothelium. Watch carefully. And you can see there it is, we're fracturing it away. There's still some viscoelastic, there we go. We keep getting more and more of it off. And again, we're staying away. We're not touching the endothelium. Never touch it. We're coming reasonably close. But just the fluidic current, just the vacuum will be enough to draw it away from the endothelium and into the aspiration port. You don't want to be in a position where you're going to damage corneal endothelial cells. You don't want a beautiful cataract surgery and a poor visual result because the central cornea is now damaged. So you always have to be very careful and very respectful of those corneal endothelial cells, particularly in the very center of the patient's visual axis, in the middle of the eye. Here at the end, you can see a little more viscoelastic stuck in the angle. We'll use our sweep technique to get that out of the angle. That's just injecting bounce salt solution to the angle of the eye. And we can wash that viscoelastic out of the eye and now finish up our case. Remember, our ideal goal for the patient is not just a beautiful cataract surgery, but a beautiful visual outcome. And that requires, of course, the beautiful cataract surgery, but also a pristine cornea. So always respect that endothelium. Don't come close to it. When in doubt, try to remove it with the IA probe instead of the phaco probe. Sometimes displace it with cohesive viscoelastic. And if you just can't get it off, just leave it alone. Thanks for watching.